Well, good morning, everybody. My name is Dan Frederick. I'm the president and CEO of the hospital here at Blake Medical Center, and I just really want to come and welcome you and kind of introduce our day today. As you can see, we have robots with us, which are pretty cool stuff. You know, I don't know if you were probably a little bit younger than me, I guess, since I'm not in high school anymore. But when I was a kid, we didn't even dream of robots, you know. And now we actually have them in our hospital helping save lives, helping do things. And I understand you all are with the Medical Academy, so you have an interest in learning about some medical things. And this technology is just phenomenal, what it can do. I believe, and Joe and them are a lot more smarter than me about this, but I believe it was originally developed by the military for military applications so that they didn't have to put surgeons, nurses, and everything in harm's way, so they could go into a battle zone like in Iraq or something, where a patient's injured, they have a trauma, they need to be operated on, and they'd put this module over here, as you see, with the patient in the field in the battle hospital, but yet whoever was going to be operating on would be sitting at these consoles in Germany or somewhere else like that. So it was really developed to keep people safe during times of attack and stuff, but I think the distance from that and the delays and stuff were such that, as you see, it's pretty intricate equipment. It really didn't work out for that application, but Intuitive, the company you're going to hear from and stuff that developed this, really took the bull by the horns and just developed this technology into something that's just phenomenal, where we can use it for very precise accuracy, for just doing things that would be very, very much harder without the robot, and opened us up to a lot of new things. So you're going to hear a lot from medical experts. I'm not a medical person. That's about the extent of my knowledge in medicine that you just heard. But you're going to hear from some people that really understand this and what it is. I'd first, though, to start your day, I'd like to introduce you to Kevin Forsyth, who's our director of our emergency department, where our trauma center is. And come on up, Kevin. And he's going to talk to you for a few minutes, I think, about ER and about health careers and that. So have a great day, and we'll see y'all later.
Good morning, y'all. Let's try that one more time. Good morning. Good morning. Excellent. Thanks for the invite today. I'm so happy that you all are here. I first wanted to go ahead and give you a little testimonial. Probably, good 20 years ago, more than that, but that's what you say, 20 plus. I would like to say that I was a result of a medical magnet program in high school, and I came out as a CNA and worked as a certified nursing assistant. So I just want to say that you will benefit from this program. It's an excellent program, and it will really benefit you. I go back to my alma mater, Boca Ciega High School in St. Pete, and I talk with them once in a while. So just want you to know that it's a wonderful program. It's great to see so many of you in there. But anyway, back to the emergency department and the trauma center. It's a really exciting department, as you all know. It's kind of neat. We never know what's coming in through the front door. And the trauma center has really added that extra excitement for us. It's really got the engagement of our employees. They're learning so much more regarding emergency medicine because of trauma being a specialty. Not every emergency department or hospital has a trauma unit. And to be able to have trauma here and saving so many lives with the really serious injuries has really helped engage our nurses and paramedics and doctors, not just in the emergency department, but throughout the hospital. It's not just, when you hear trauma, it's not just the ER, it's throughout the whole hospital. But knowing that it starts in the ER and us to identify what's going on with these patients has really helped our facility and the quality of care that we're given. We're just elevating our game for the trauma. The basis of what emergency departments do is we have a saying in the emergency department. We know something about everything and a master of nothing. You know, and that kind of goes along with, we got to know a lot about urology, heart, neuro, bones, all these different things that patients are coming in with complaints versus in the ICU, like in the cardiovascular ICU, they're masters of cardiovascular services, of what's going on with your heart. But the emergency department, yes, we're good at what we do, but we figure out what's going on with them, and then we get them to those departments and those physicians and nurses with their expertise. So when you're figuring out what you want to do in your career, there's so many different types of specialties, not just emergency department and trauma, but in cardiovascular, in the heart or neuro. So definitely take that in consideration, what you want to do in the future. But the emergency departments, we figure out what's going on with them, we stabilize them, and we get them up to where they really, to the experts for them to really fix the issue. But that's essentially what's going on with the emergency department. Lots of things coming in, lots of exciting things coming in, and I really hope that you guys figure out what you want to do in the healthcare. There's so many different other opportunities in the healthcare field, so feel free to get a hold of me if you ever have any questions. I'll be glad to help you out.
All right, good morning, everyone. My name is Joe Anderson. I am the Senior Clinical Sales Manager for Intuitive Surgical. What that means to you guys is I'm the guy that's out here in the field that's teaching the surgeons in the area how to operate this equipment and how to do these particular surgeries with the DaVinci robot, okay? All right, so before you guys were born, you know, back in the late 80s, early 90s, you know, the way of doing surgery was that open. You know, no matter what kind of patient or surgery you needed to have, they opened you up. So if they took your gallbladder out, you had a small scar. If they took your appendix out, you had a small scar. If they, you know, if they doing a hysterectomy, you had a large scar. So back in 1985, Dr. Eric Lemieux, or Mew, out of Germany, started doing this laparoscopic procedure. He took these straight instruments and he put them inside your body, and there was a ton of backlash against him, talking about it was demonic, it was horrible to do this patient. No one's ever going to adopt this type of procedure. And if you fast forward to today, 95% of all surgery is now done with laparoscopic instruments of some sort or another, okay? So my point in saying this is surgery is constantly changing. And you guys in the medical field, you know, once you get in and out of medical school or wherever you're going to go, this technology will have already changed. In fact, it's already changed today. So, you know, I'll get into that here in a minute too. So in 2000, the first DaVinci prostatectomy was done. And anybody know what a prostate is? All right. Okay, so prostatectomy for us men, very important. Anyway, the first procedure was done in 2000, all right? And again, with this technology, it was again thought of as it wasn't good. Nobody would ever adopt it. Nobody would ever take on with it, okay? But if you fast forward to today, what this is saying over here, it looks at the adoption curve, all right? This is an adoption curve that you see here. What that is saying now is that 85% of all men, 85% of all prostatectomy surgeries that are done in the United States are done with the DaVinci robot. So we've changed now from open to laparoscopic to robotic, okay? So if you look at all the procedures that we are kind of starting to do, this is urology with your prostatectomies over there, and the pointer isn't working, whatever. The prostatectomies. Today, GYN oncology and benign GYN. So any type of procedure that you're having done, like hysterectomies, endometriosis. There's a lot of those procedures that are done today. And right now, in the market that we're in today, there's about 76% of all GYN procedures that are done are now done robotically. And where we're at today here with general surgery is this is our newest area where we started doing is you know, general surgery being like colorectal, your gallbladder surgeries, your hernia surgeries, whatever those may be. We are now about 7% of that is being done robotically. So we're constantly changing markets, changing the way that surgery is being done with their patients, okay? So, and why are we changing that? And what are the key things that are making us different? And why are surgeons taking on? Why does it make it better for patients? You know, we have basically 4 pillars. One is the multi-port and single site access, okay? What I've got shown up here today is a multi-port system, all right? Meaning what we've got is we've got 3 instruments, 1 camera. All those are going through into your abdomen through an 8mm incision, okay? So we also have a single site technology, which I don't have here with me today, but what we do with those is we can do the entire procedure through 1 incision through your belly button. So that's how we're constantly changing surgery. The difference in our technology, the main thing that we're going to talk about today is the 3D visualization. laparoscopic surgery, in open surgery, you could see everything. You're in there, you can see around things, behind things, whatever it may be. Laparoscopic surgery, as you're putting the camera in, what you're seeing is everything on a TV screen. So you're doing a 3D surgery in a 2D environment, okay? So our technology, if you can see here, it's got the 2 cameras that are inside, and you can see them inside here if you guys want to look at it later. There's 2 cameras inside there, okay? 2 scopes inside there. So we actually have given the surgeon back that 3D visualization that they didn't have with laparoscopic surgery. The other one's the wristed instrumentation. That's what I talked about a minute ago, being able to maneuver your wrist, fingers, grab, whatever it may be, your roll, okay? So, and I'll get into this in a minute too, but the other one is a dual console as well. So every teaching institution in the U.S. right now has what we call a dual console, or the ability to write on the screen and be able to maneuver things. So this is some of the things that our technology allows you to do, to be able to teach people, to be able to teach new surgeons how to do these procedures, okay? But really what I wanted to get into is kind of the nuts and bolts of the system itself. So, so what you can see is we have three different systems. We have the robot. Can you see this black band right here? All right. So this is what we call remote center. All right. So what happens is once we put this inside your abdomen, this goes inside the muscle layer of your body. Okay. So what then happens there is the entire arm will rotate around that fixed point. Okay. So it doesn't matter where you're at or whatever. So what this does is it's actually reduced the amount of port site trauma in patients. So that way there, if you're having a laparoscopic surgery, they're kind of wrenching in around. They're really kind of wrenching on that muscle layer. This reduces that pain for patients, so the patients are actually telling everybody that they're having less pain than they have had before with prior surgeries. So I'm going to get in. Can I get a couple volunteers first? So I'm going to have you sit down on the console, okay? And actually, it might be hard for the rest of you to see. All right, but what we have inside here is we have the shell, or the vision port, okay? Inside here is where we see our 3D stuff, all right? Here's where you're going to control these instrument arms over there, okay? So what I'm going to have you do is put your head inside. You're going to sit down in here, put your head inside there. You hear it beeping? That's how it knows that you're inside and ready to go. These arms will not move unless your head's inside there. Okay, now roll your hands around. Just kind of get used to them, move them. All right, back your hands up, pull them back towards you, okay? Now what I want you to do is I want you to get as close to the tip of that as you can without actually touching it, okay? Get as close to it as you can without touching it. When you get close, when you feel comfortable, don't stop, okay? So Julie, now what I want you to do, Julie, is grab this and pull it this way, okay? All right, that's good there. Now Julie, hit that arm swap pedal button again. Now, Julie, move your other 2 hands, your left one and your right one that's out of view right now, and I want you to pick up that rubber band right there. Can you move your right hand too? You're just moving the left one. There's your right one. Here it comes. It's all right. No worries. Okay, see this little rubber band that's down here that I've got these blue marks on? Pick that up. So see what I'm showing here, guys, is you have the ability to grab tissue, pull it out of the way, and lock it in place, and then continue to work with your other 2 hands. Okay? All right? And you can see how Julie's having a rough time here banging into things and stuff like that. So, I'm glad she did it, because what that shows is this isn't an easy procedure. So a surgeon will go through no less than 30 hours of training on this before he ever gets into a surgical environment. So this isn't something that you can just say, I can come in and do a demonstration with you today and you can get on tomorrow and do these procedures, okay? So there's a lot of training that's involved with this as well. Jenny, so what I'm going to have you do is see this pedal right here that's got the camera on it? Yeah. That's your camera pedal. So what I'm going to do is I'm going to have you zoom in. So what you do to zoom in is you push down that camera pedal, pull those arms towards you, okay? Has anyone ever known that all 50 states are listed on the back of a $5 bill? Yeah. Push that camera pedal in. All right, so now put your finger and thumb in there. There you go. Pinch them, and then step on that camera pedal. Now zoom in towards this area of the $5 bill, okay? There you go. It's rough, see? I told you it wasn't easy, but keep coming in. Now push your hand. Okay, now let go of the camera pedal. Push your hands away from you. No. In there, in that. Keep them in there. There you go. And push your hands away from you. All the way down, like I did it before. All the way back here. All the way back there. Okay, now step on that camera pedal again. And pull them back towards you again. All right, see how these states are starting to come in? There's Georgia, Connecticut, Iowa, Wisconsin, California, Minnesota, Oregon. So now you see why surgeons go through 30 hours of training before they get on a patient, okay? So it is simple once you get the grasp, but there is a learning curve just like there is with anything else. So actually I got some more stuff for you guys to do now. I'm just going to let you guys get on the consoles and play so you can see how it's going to work.
Move the grip. Okay, good.
Yeah, just sit there and roll that penny back and forth. Yeah, so you roll it around. There you go. Make sure to let go of one hand before you, there you go. This is just one of the exercises that we make surgeons do during this training exercise, okay? A device that's actually going to make surgery better for patients, and it appeals to the newer aged people. It's coming out. You got the video gamers that are out these days, and it makes it really easy for them with the hand-eye coordination for them to be able to look at this technology and to see the way that it's changing patients' lives. The DaVinci robot, what it's doing is it's actually taking an open environment surgery and putting it in a laparoscopic environment. So we're giving the surgeons their hands and their wrists back. So we're able to actually do a procedure with basically the surgeon having his hands back inside the patient without actually opening the patient up. So it helps back with length of stay, healing time, and it's just and we can actually offer a minimally invasive procedure to a larger and broader range of patients that were never able to be offered a minimally invasive surgery before. Well, the benefit is just the recovery time a lot of times. You know, recovery time is easier for patients. They're feeling less pain because they're having less open procedures. They're having less open environment. They're having less torque on their skin. They're having, you know, there's a less chance of infection, less chance of reoccurrence than there is with the DaVinci system than there are before, because there's more control. There's more precision than what there has been with the laparoscopic instruments that are involved in laparoscopic surgery. Like I said, we've got their wrists back, they've got their hands back, so they can get inside the patient and actually move in ways that they haven't been able to move before. One of the pillars of our technology is the 3D visualization that we have, okay? And what he can see he's looking into right now is the vision console. The surgical 3D environment is right here. Our scopes have 2 cameras within them. So what that does for a surgeon is it actually gives them back their depth perception. They can see around things, behind things. You know, they are able to work in areas that they haven't been able to see before. That's the biggest thing is surgeons will tell us that they've never been able to see the anatomy the way that they can see it with the DaVinci robot. What Cody is doing here is he's actually operating the surgical instruments from inside here. If you can see, go ahead and move your wrist up, Cody. So what this is doing is it's actually mimicking everything that he's doing inside the patient. When his hand moves up, the instrument inside moves up. When he pinches his fingers, the instruments pinch as well inside the patient. So what he's doing, this machine is actually mimicking every movement that he does. And that's what he said, giving your surgeon their hands back. That's exactly what we're doing, is giving you your hands back inside of a laparoscopic environment. The surgical environment is constantly changing, and what I want them to know is, you know, since our inception in surgery in the early 2000s, we've changed the site or the way that surgery is being done. We are actually able to offer a broader range of patients a minimally invasive approach than has ever been offered before, and that's really what we want these patients, these individuals to know, is that we're changing the way that surgery is being done.
Well, you know, these students are our future. They're kind of the best and brightest that are in our Manatee County public school system. You know, they're dedicated to learning more about health careers, about the sciences. So I think it's important that we expose them to what the careers for them are going to be. You look at, you know, what we're talking about today is robotics. I mean, that's something that 5-10 years ago nobody ever even thought of. Now, when these kids, when they get out and they're practicing medicine or nursing or whatever health career they choose, this is going to be common to them. So I think it's important to expose them to the future right now. Yeah, I think something like this, especially at their age, to be able to come in and actually touch and play with the robot, and I think you got the message a little bit earlier that you can actually get into the consoles and move the arms and pick things up with it, move things around. So I think it will create that enthusiasm for them. It'll really be something that these kids, at a young age like that, if they have a spark for healthcare, this is going to be something that just pushes them ahead to see something like this. Blake Medical Center, I think we're very proud that we do have a lot of sophisticated equipment. We offer a lot of very intensive services. We're the tertiary facility for this area. But when you really kind of cut through all that, it's really about people. It's about people taking care of people. As I tell our staff in orientation, that if you take the people out of it, we're just a big pile of bricks. We are here as a service organization to take care of them. And our mission, I think, kind of says it best. It's to provide exceptional care for every patient every time.
The Medical Academy at Manatee High School is the longest established academy in Manatee County. It allows our students that are interested in the medical fields to gain experience and access to healthcare professions, hands-on experience, opportunities to see different healthcare careers and pathways that are out there, so that they can figure out now what really they want to do. We have a lot of kids that come in with a thought in mind of what they want to go into, and over the course of their 4 years they get to see so many different healthcare careers and opportunities that it gives them a better chance to kind of hone in on what they want to do career-wise. Without the ability to partner with all of our business partners locally, the experience that we could give the kids in the classroom is really limited. By being able to get our kids out to the hospitals, by being able to get them with EMS, being able to get them on the sidelines of some of our sporting events, we give those kids an opportunity to have that hands-on, firsthand experience that you can't replicate in a classroom. There's only so much you can get from reading a book or watching a video. When you send the kids out and they do a ride along, or they do a job shadow or something like this where they get a chance to see these instruments being used, that's something that a textbook or a classroom teacher just can't replicate. And so that's the real benefit to this type of a program. The Medical Academy, with all of our academies, whatever area of interest the student has, the more involvement we have from the parents, the more involvement we have from the community, the more valuable that experience becomes to the student. The more hands-on, the more firsthand. Those are all things that these kids are going to take with them long term. A test in my classroom on one unit of a book is not going to carry with them the rest of their life, but the experiences they get from all of these community resources is really what kind of shapes and changes them down the road. And the more that parents become involved, the more the community becomes involved, the better product we're going to be putting out there down the road, so that hopefully you and I, when we need care, we have doctors and nurses that know what they're doing and have that experience.
Well, our goal is to provide an introduction to students who are interested in a career in healthcare. We have many of our graduates have gone on to be physicians and to be nurses and physician assistants, and we're just really trying to provide them the groundwork. Some of them decide this isn't the career that they want to follow, but many of them, it actually gives them, just like when we're able to come here today, it actually shows them, yes, this is really what I want to do. Well, if a student is truly interested in pursuing a career in medicine, this is the best track to take. It's not a very difficult track to take. They are electives, but it certainly provides them the hands-on opportunity so that they can see this is really what we do in medicine. Now, we're not going to let them do surgery, but we also will give them the opportunity to be able to shadow and actually do internships with our community partners, which we really, really appreciate. It's hard for them to grasp, but for me, it's pretty amazing how far we've come as far as surgery and the procedures, and I really appreciate the fact that the community actually welcomes teenagers. Many of them do not, and I want them to also understand the opportunity that they've been given.
The reason why I selected the Medical Academy, because in the future I would like to become a dentist, and I knew it would benefit me a lot if I got started now and started learning some new things. And I'm in it because I always dreamed about becoming a dentist, and this is a dream of mine. don't be afraid to chase your dreams. If you want to become a doctor, RN, join the medical academy and start volunteering and ask questions and do your research.
I really enjoyed it. I got the opportunity to actually try out one of the simulators, and a general surgeon was one of my original planned out careers, and it was just a great experience. I've been in the medical academy for years. I've also participated in HOSA, which is a club for people who want to do something in the medical academy. Ever since I was about 4 years old, I know I wanted to be a doctor, and I knew the medical academy would help me further, get deeper into this dream career. They dedicate so much time to helping you understand. It's not just let me lay these terminology words on you and just figure it out yourself. You actually learn what you need to know to guide you into your wanted career. I think this is a great opportunity because it's not just like you're delving into this medical world without knowing anything. They give younger people an opportunity to know this is what it's going to be like, this is how we're changing, and you're experiencing that, and it's a great opportunity.
One of the great things about Manatee County and Bradenton is that so many of us do have the opportunity to stay and give back to our community. A lot of my friends and family, were born and raised here and continue to work here, which is fabulous. So the opportunity to reach out to our local students, these are our future. I mean, a lot of the people here today may end up working in healthcare somewhere else, but they might end up back here and taking care of my family. So I want to make sure everyone has as much exposure and interaction as they can.
My name's Zoe, and I'm here today because the surgery robot seems really cool to learn about since I'm in the medical academy. I want to be an EMT when I get older, and Manatee has a EMR program that I'm trying to get into.
I'm Casey, and because basically the same reason, I think the new surgery robot, I think it's really cool, seeing it and being able to see it firsthand and everything.
I think it's amazing, the technology that they've used and are working with.
It's incredibly rewarding. I mean, there are very few industries where you go to work every day knowing that you're going to make a difference in people's lives. And just the teamwork aspect. I mean, these are three very different ideas, physical therapy, EMT, orthopedics, and yet all three of those work together so closely. Every person in this hospital is part of a team. We care for patients from environmental services to the food and nutrition, all the way up to the surgeons. Every member of the team is so integral, and that's one of the great things about healthcare. Top to bottom, we're dedicated to the community. It's amazing. From the boardroom down to the staff level, every single person here is dedicated to their patients and to the Manatee County community. It's impressive. It's an impressive thing to see.